Hi there, I'm Esme with Hotwire Your Life Mojo for Boomer Chicks, welcoming you to episode 3 of Safe Sex for Boomer Chicks with renowned gynecologist Dr. Will Steinberg. Now, if you'll recall in episode 2, I asked Dr. Steinberg if it was possible to catch a sexually transmitted infection without penetration. And his answer was a most resounding yes, you certainly can. So now my question for Dr. Steinberg today is, how do you even know if your partner has an STI? How can you tell? So let's find out what Dr. Steinberg's take is on that.
The scary news is that you don't. We know from other sexually transmitted infections, like herpes, that 80 to 90% of the transmission of herpes occurs when there's no sore on the penis or other areas of the genital area. We know that the virus can be shed even when there's nothing visible, and that's frightening, which means that if an individual has had a history of herpes in the past, they must always use protection, that there is no safe period of time. Similarly, the great majority of men will not show a wart on their penis or an ulcer on the penis. And I think it goes without saying that most women would not allow any contact with their body if their partner did have something abnormal on their genital tract. So that the bad news is you have no idea if your partner has HPV or HSV unless they demonstrate something. There is no easy test to send your partner for before engaging in sexual activity to clear him and give him a clean bill of health. The blood test for HSV is available, and it will only show you whether the individual has had in the past the genital type of herpes. The bad news is that 20% of young sexually active people, by the time they're 40, do exhibit evidence of having had contact with the genital HSV.
So now I'm wondering, if there are any external signs of infection, what exactly would I be looking for?
If there was anything like herpes, you would see small ulcers or sometimes small blisters with a red area around them. These areas might be quite small, very small, and difficult to note. If the man had HPV or human papillomavirus, he might have genital warts, which would be like a little mushroom coming off the shaft of his penis. It might be on the scrotum. It might be around the anus. So you may not be able to detect either one of them, especially in dim light.